When we transfuse blood, there can be two types of reactions that we can expect to happen. So that can be the febrile, non-hemolytic kind of transfusion reaction, or the acute hemolytic type of transfusion reaction. Now, how will you differentiate between them clinically? With acute, as the term itself says, it is acute. So as soon as you transfuse the blood, the reaction will occur within minutes. And in febrile non-hemolytic transfusion reaction, it is within hours. So it takes time for the reaction to happen. So that's drastic difference in the time of onset of the reaction. And with the hemolytic reaction, there is lysis of blood, just like the term itself says, hemolysis, lysis of red blood cells, and it can lead to signs of shock, so that's quite severe. And also the patient will have pain at the transfusion site. So if you're standing there transfusing blood and you see these things happening, your immediate reaction will be to stop the transfusion, right? So that's the main step of the management. Don't transfuse anymore because the blood is not compatible. So there's no point in continuing the transfusion. And then you can also give oxygen and fluid support. Whereas here in febrile transfusion reaction, as the term itself says, there is fever, but you can also have fever in acute hemolytic transfusion reaction. The only difference between them is that the temperature febrile non-hemolytic transfusion reaction doesn't increase as much. So the temperature can be more than 38 degrees Celsius, or when compared to the pre-transfusion temperature, it can be a variation of more than 1 degree but less than 2 degrees Celsius. Whereas in the acute hemolytic transfusion reaction, the temperature will increase more than 39 degrees Celsius usually, and when compared to the pre-transfusion temperature, the change will be more than 2 degrees Celsius. So for example, maybe somebody's baseline temperature was 36. The temperature after the transfusion with acute hemolytic reaction can go up to 38, so compared to the pre-transfusion temperature. And here in febrile non-hemolytic, you can see it takes time to happen, the temperature change is not as much, and there is no hemolysis happening, so you don't need to worry about stopping the transfusion, but you can slow down the rate of transfusion and keep observing the patient frequently to just make sure they don't develop any other severe complications that may lead you to changing the style of management. And usually for most transfusion, before the transfusion is even started, the patient is given paracetamol and antihistamine prophylactically just to prevent the reaction from happening. Mainly the antihistamine is given to prevent the non-hemolytic reaction, because the reason this is said to happen is because of some cytokines that's being released from the donor's WBC. So to prevent that reaction from happening, it's okay to give an antihistamine. So that's the difference between the clinical features and management for febrile non-hemolytic versus acute hemolytic transfusion reactions.